Did you know that there are some instances in which medical insurance will cover for procedures like eyelifts and tummy tucks? Well, they do. And if you're a coder who is working with these types of procedures, it's important to know what is a patient responsibility versus what is going to possibly be covered by insurance, and what are the circumstances in which insurance will pay? What is the medical necessity? And that's what we're going to go over today. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. But this video may be of interest to another audience, and that's those who are considering plastic surgery and want to know what are the requirements in which insurance might pay for those procedures. So I'm making this video because a couple of weeks ago I saw a Instagram reel, which I think originated from a TikTok, where there was a woman talking about, hey, sometimes your insurance can cover for tummy tucks. I've seen this case where this lady had a tummy tuck and her insurance covered for it, so check your policy and you can possibly get tummy tucks through it. So I actually made a TikTok where I tried to, in 60 seconds, pack in some of the information regarding when insurance will cover, and I wanted to elaborate that a little bit further here. So to start out, when your medical insurance is going to cover something, it is because you have a qualifying medical condition. While there may be some procedures that cross over and are also cosmetic in nature, the reason that they're covering for them is because of the medical need. It's not because you have such a great policy that they just want you to be cute and they're like, hey, as a bonus, we're going to cover for you to have a tummy tuck. The other thing I want to cover is the difference between cosmetic surgery, plastic surgery, reconstructive surgery, because there was someone who commented on my video, and I did delete it because it was just a really unfortunate comment, where this person had said that no self-respecting quality plastic surgeon charges with insurance, that they all just charge out of pocket. And I think this individual just really didn't understand what plastic surgery entails. So when they say plastic surgery, that plastic comes from the Greek word plastikos, which means to mold or to form. So a lot of plastic surgery is not just cosmetic, it's reconstructive as well. While a lot of us traditionally think of plastic surgery as things like breast augmentations and tummy tucks, it's also things like cleft lip and palate repairs, it's eye lifts, it's reconstruction for acid burning victims, patients that have been in automobile accidents and had trauma to their faces and need facial reconstruction, dog bites, laceration repairs in sensitive areas, wound care. There's a lot of things that are covered by plastic surgeons. Even if you think of in the breast region, all the patients that have had breast cancer and have had mastectomies and need reconstruction of their breast, that is done by a plastic surgeon. So to say that no quality plastic surgeon accepts insurance is a really horrid and wretched thing to say, because that's basically saying that patients that need cleft lip and palate repairs, reconstruct into their faces, breast cancer patients should not have quality plastic surgeons performing on them, that they should have to pay out of pocket. But yes, plastic surgeons also do cosmetic things, Brazilian butt lifts and liposuction. That's all part of plastic surgery, but there's a lot of it that is medically necessary things or reconstructive in nature, like those breast cancer patients where we're reconstructing their breasts. So even though a patient may be having breast implants placed, there are reasons to have that done for cosmetic purposes, but then we also have breast cancer patients that have that done for a medically necessary reason, to give them back a normal form or the form that they had prior to having their breasts removed. Not to get too far off the subject, but there are actually laws in place that if an insurance company pays for you to have a mastectomy because you have cancer, they are also required to cover some form of reconstructive surgery for the breasts. If you're wondering why I seem to know so much about plastic surgery, that's actually my specialty. I am specialty certified in plastic and reconstructive surgery, which is no longer a active credential with the AAPC because they didn't have enough examinees to offset the cost of holding that credential. So I get to keep my credential and I have to get CEUs for it, but they're not actively taking new test takers for that credential. Over the past decade, I've worked with about 5 plastic surgery practices, and I've learned quite a few things in that time. And to be fully transparent, I've actually had quite a bit of plastic surgery myself. I had a sleeve gastrectomy back in 2013 and have had a corset trunkplasty, a bilateral arm lift, an inner thigh lift, and liposuction on my knees, my arm, my abdomen, probably a couple of other areas. And I am someone that did have insurance cover the removal of skin from my abdomen. So going back to my earlier statement, insurance isn't covering this because they're like, oh, we just want you to have a cute flat tummy and we're going to cover for you to have a tummy tuck. And there's actually differences between a tummy tuck versus a paniculectomy, and that's more so what insurance is covering. They're covering just to remove that excess skin, not to necessarily make you all tight and snatched, but to get rid of that excess skin, because that's really the core of the medical problem. So with a paniculectomy, they remove the pannus, which is that hanging fold of skin from the abdomen, and you wind up with a horizontal incision, not unlike a C-section, where if you have a good plastic surgeon, they keep it pretty low so that you can even wear like a bikini, and that bikini will hide that incision. In a tummy tuck, it's a little more of a contouring procedure, not just removing that fold of skin, but kind of reforming the abdomen shape. And oftentimes there's this diastasis recti, which is when your abdominal muscles separate. This happens just sometimes normally as we age, oftentimes weight gain, childbirth. Those are things that will separate those muscles. And in order for it to just look better, your tummy to look flatter, they suture those muscles back together as part of a tummy tuck. And often in these procedures, they have to move your belly buttons, because the belly button isn't just a little hole, it's actually a stalk. So there's a whole stalk that comes out and goes into your abdomen. So they core that out, and then they basically make a little slit where your new belly button's going to be, because they've pulled all that skin down, right? And they need a new slit. They move that in and suture your belly button into that new spot. And in the coding realm, we refer to that as an umbilical transposition. So in the coding world, we have CPT 15830, which is for the removal of the excess skin of the abdomen. And then 15847 is more so the more cosmetic components of it, the suturing of the muscles back together, and then moving your belly button. So sometimes insurance is more reluctant to cover that 15847 code, because that's the more cosmetic type of part of the abdominal procedure, where they're suturing those muscles back together, and usually there's not a lot of medical symptomology associated with the muscles. They're not causing, pain or any medical conditions. It's just that the muscles separated. Actually, in my case, my insurance didn't want to cover initially for that code, and my plastic surgeon basically got on the phone with them and said, hey, I'm doing this because I need to move her belly button, not necessarily because I'm trying to do cosmetic surgery on her, but because I need to move her belly button because she has all this hanging skin, and we need to create a new belly button and move it for that purpose. And in that case, then they were able to approve me to have that part of the procedure done. So what insurance is really looking for when they approve for abdominal skin removal is things like you have a lot of excess hanging skins. There's actually grades of the pannus, and they grade them in different numbers. So it depends on how far the pannus is extending. If it's past your pubis, if it's down to your knees, there's different grades involved. So some insurances may say that it has to go past a certain area, the hanging skin, in order for it to be covered. Most of them, though, they're looking for that there are rashes or infections, and that there were conservative treatments applied that were failed. So for example, the patient has a lot of sweating under their folds of skin, they get sore, they get raw, there's openings, they get rashes, maybe they were given prescription powders by their PCP, it didn't help. And the reason that they cover for this skin removal is because if that continues, it gets sore and open, then they're a lot more prone to infections. If they wind up with infections, they're going to land up in the hospital, and that's going to be a lot more expensive than a planned overnight surgery. So in order to get these procedures covered, oftentimes you need to start an early paper trail. As soon as the patient is having sores and rashes, they need to take photographs of them, go to their PCP, see what conservative treatments they can take. And photos not only help with that component of it, but when the patient goes to the plastic surgeon for the consultation to see if they meet the criteria, that plastic surgeon will more than likely take very intimate photographs of the hanging skin to submit to insurance to prove to them that it is medically necessary, that there is such an excess of hanging skin, so that they can get approval for that service. So before I go into a couple of insurance samples of what their coverage criteria looks like, I just want to mention that if you have a particular insurance, I can't say, for example, that, oh yeah, all Highmark insurance will cover this particular procedure, because there are nuances of each individual policy. So a patient may be working for a particular employer where they have carved out these types of services because they don't feel that it's something that could be covered. You'll even see this sometimes with different employers that have religious beliefs that maybe prohibit things like birth control. So in their particular policies, they won't cover birth control. Same kind of thing. Maybe they can get a cheaper insurance plan for their employees if they carve out things like abdominoplasties or bariatric surgery or certain types of services. So it really does depend not only on your insurance company, but the specific policy that is carried. One thing you can do is just take out your insurance card, flip it to the back, call that number, and ask them if they cover that type of procedure. So the first policy I want to look at is one I found for Highmark in Pennsylvania. Now again, depending on the specific policy, there may be a difference in coverage. But if we look at this, this is from 2013, and it says coverage for cosmetic services. And this says abdominoplasty or paniculectomy, also known as a tummy tuck, and it gives the CPT codes 15830, 15847, and 17999. 17999 is a miscellaneous skin procedure, and one thing I do want to point out is that there are codes for liposuction, and if you'll note, they are nowhere on this coverage determination because that truly is more cosmetic. So this is some of their coverage criteria. All of the following have to be met. There have to be pre-operative photographs that document the hanging folds of skin at or below the level of the symphysis pubis. Now let's Google that and see what that might look like. So I talked about how there's the grading of how low that pannus hangs, and when I looked at Google, it kind of looks like that's a grade 1 pannus. It also says that the medical record has to include that fold causes chronic intertrigo, which is that dermatitis occurring on opposed sides of surfaces of the skin, skin irritation, infection, or chafing that consistently recurs or remains refractory to appropriate medical therapy, including prescription medications over a period of 3 months. So in this one, they're outlining, we want to see that you tried conservative treatments for 3 months and they did not work. It also says here that if it's a patient who had bariatric surgery and had a massive weight loss, and that's why they have these hanging skins, that it is at least 18 months following their bariatric surgery. And then it just gives a little bit of information about the coding, and it says you're only supposed to report that code 15847 with the 15830 because that's an add-on code. Then it says when an abdominoplasty is performed without a paniculectomy, we report code 17999 with a description of the service. And then this is interesting. It says about inpatient or outpatient that they want to see this as an outpatient procedure unless the patient has some special circumstances that require an inpatient or overnight stay, such as presence of a comorbid condition that requires more monitoring in a more controlled environment, such as the inpatient setting. Now, worth mentioning for patients that are going to be paying out of pocket for these procedures, inpatient stays cost a heck of a lot more than a same-day surgery just because of the extensive amount of care involved. Now, I also want to take a look at my local Medicare contractor, Novitas, and see what they say as far as coverage. So active local coverage determinations, and typically they list them in a policy that's called cosmetic and plastic surgery or cosmetic surgery. Let's see if we have it here. Here we go, cosmetic and reconstructive surgery. So this policy is going to include a lot of things like dermabrasion, reduction mammoplasty. Oh, here we go, abdominal lipectomy and paniculectomy. So what this says here, and I'll try to see if I can zoom this in a little bit too. So it says abdominal lipectomy or paniculectomy is surgical removal of excess fat and skin from the abdomen when surgery is performed to alleviate such complicating factors as inability to walk normally, chronic pain, ulceration created by the abdominal skin fold, or intertrigal dermatitis. Such surgery is considered reconstructive. So that means that they will consider it for coverage by Medicare. So preoperative photographs must be required to support justification and should be supplied upon request. So again, that patient's going to need to get down to their skivvies and be photographed by the plastic surgeon to show how far the pannus goes down, or that there may be intertrigo and dermatitis or ulcers or skin openings, etc. Paniculectomy will be considered medically necessary when the pannus or paniculus hangs below the levels of the pubis, and the medical records document that the paniculus causes chronic intertrigo, and that explains again what intertrigo is, that consistently recurs over 3 months while receiving appropriate medical therapy, or remains refractory to appropriate medical therapy over a period of 3 months. So again, 3 months, we tried a bunch of creams and potions and lotions, they didn't work. And then it says, note, if the procedure is being performed following significant weight loss, in addition to meeting that criteria above, there should be evidence that the individual has maintained a stable weight for at least 6 months. If the weight loss is the result of bariatric surgery, abdominoplasty or paniculectomy should not be performed until at least 24 months after bariatric surgery, and only when weight has been stable for at least the most recent 6 months and infections and inflammation continue. So this is even more aggressive than the Highmark policy, where they said it has to be 18 months out from bariatric surgery and I believe 3 months of stable weight. So you can see that there's no real blanket of, oh, it has to be X, it has to be Y. All of these different insurance policies are going to vary. The other cool thing to talk about is multiple procedures. So say a patient comes in and they want their abdomen done and they also want an arm lift, but they know there's really not anything medically wrong with their arms. They just cosmetically don't like them and want them to have a tighter skin on them. What happens is there's usually a larger discount for the patient to pay out of pocket for the non-insurance covered components. Reason being is a lot of that cost is eaten up by the staff and the room and the medications. And if you're already have your IV started, you're already in the bed, a lot of those costs get cut down because the starting portions of that, the bulk of it has already been covered by the insurance. So you're just kind of paying to add on a little bit to that. So most plastic surgeons do have a pretty hefty discount if you want to add on a procedure and have that paid out of pocket. But remember, if you're paying out of pocket, you're going to get 3 bills, not just the plastic surgeon services for their awesome work that they're going to do, but for the anesthesiologist and then also for the facility that you are using. And most of these procedures that are more like the abdominal stuff, they do want to keep you overnight. There are some that might be a same-day procedure, but if you're having a lot of reconstruction done, they typically want to keep you overnight. So now let's talk about documentation. What does the plastic surgeon need to put into their documentation? So they need to avoid words, first and foremost, like cosmetic dislike, patient doesn't like their appearance, they complain about how they don't like the way they look. Those kind of terms that just are cosmetic dislike sort of terms, those have to stay out of the documentation and really focus on things like patient is having sore, red, rashy, paniculitis, they're having potential infections, it's hanging past a certain area. All of the symptoms of that, and not speak so much to the fact that, oh yeah, the patient also doesn't really like the way it looks. I did get some comments on my original video like, well, how do you get the plastic surgeon to use the right code so that it gets approved? It's not so much using the right codes to get them approved. I mean, we could call a breast augmentation a carpal tunnel repair and submit that code, but again, this is a medical insurance. We need to cover it for the right medical reasons. Plastic surgeons actually spend 6 years in residency, so that's in addition to all of their bachelor's degrees and then medical school and everything else that they have to do. So most of them aren't willing to kind of throw that aside in order to manipulate some documentation in order to get a surgery paid for a patient. So they know their book of business. They know what codes to use. It really is the key of making sure that the documentation supports it and that patient has the supporting medical necessity to get it covered through their insurance. Now, if their insurance just blanket doesn't cover that procedure no matter what, there's really nothing that that provider could do compliantly in order to get that service paid. If you found this video interesting and you want me to cover more plastic surgery topics, definitely let me know in the comments below. Otherwise, I will see you in the next video. And until then, just keep on coding on.